it's so nice to see that we've got a packed house for this. It's good to see you guys again. I've been over here several times over the years. This is my 31st year. I've been on health and welfare since '02. I've been chairman since 17. So let's just cut to the chase here. This was driven largely because of money out of your pockets. Okay. When you're talking about UHC, the reason that we paid this premium last year is that this fund was newly consolidated, and we were really trying to get our feet under us and just go down the road. Well, about maybe 3 or 4 months ago, and I don't know exactly when it hit, UHC sent us a bill for a 36% increase over what the increase was last year. Okay? United Healthcare. Yeah. UHC MAPD. So anyway, thank you, Bill. So when I say UHC, that's United Healthcare. United Healthcare actually sent us a increase for 35.35%. The range nationally was somewhere between 17 and 40%. They sent us a 36% increase. Okay, that is huge, gigantic money out of your pockets. And what we are going to do 1/1 of 26 is actually greatly reduce what's coming out of your pockets, what you're going to be able to put back on your pension, and it's also better coverage. And we'll go through that. So right now, and I think Julie and Josh are passing this out. Does everybody have this? The talking points? Okay. Because we can go over a lot. Sherry's going to go over a lot. So will Josh, Julie, and Mark. But really, just to kick this off, again, this comes down to money. Right now, the CIL tie-in plan is $82 per person per month. Okay? So what happens is that all of our participants on the CIL tie-in plan, what I've always called the CIL tie-in plan, everybody gets Medicare Part A for free. B is the part that you have to pay for, and that's $185 for 2025. Okay, you're going to be able to elect vision. You're going to be able to elect dental, and I'm assuming about a $28 Part D plan. So, and I'll tell you right now, I sign up a lot of people on Part D. I do open enrollments. If you had your medications here right now, I can sign you up on a Part D in 15 minutes or less. Okay, I'm not worried about that. What I am worried about is what's coming out of your pocket. So, assuming a $28 Part D, that comes to $307 per person, or $614 a couple per month. 1/1/26, if we would have paid this United Healthcare bill, that would have taken you to $630 per person, or $1,260 per couple. That's a difference of $646 per couple per month. Okay, so that is a huge savings in itself. But coming over on the to the CIL tie-in, there's actually more savings because the UHC plan actually has a deductible for major medical. CIL does not and never had. So whatever, for the 65 plus crowd, which this is everybody, or if you're not 65, you're on Medicare by virtue of being deemed totally and permanently disabled. But for the 65 plus crowd, that is absolutely huge. But on our plan, whatever Medicare doesn't pay as primary, CIL is going to pay 100% without a penny out of your pocket. So that's going to be further savings. And one thing, where's Jeff?
So we're talking about major medical right now?
We're talking about major medical right now. Okay. That is just this year. Okay. And really what's driving this is when Medicare put a cap on prescription drugs. That's what's driving a lot of this, if not all of this, because let's just say, let's just lay it on the table. The only real reason for anybody to stay on UHC was because they used a catastrophic amount of prescription drugs per calendar year, which we define as $8,000 or more. Medicare put a cap on that. It's $2,000 this year, going to $21,000 next year, $2,100. Okay. Now I'm telling you right now, these carriers are out for themselves. They're not in this to lose money. So if they know that they're going to be on the hook for anything over $2,100 in 2026, they're going to get their money back. And what they did is jack up the premium cost. So that's why we're doing this. Okay. This is going to be, a huge benefit for you. This is going to be better coverage. The only thing that we're going to have to do, and we're on a little bit of a tight time frame, but honestly, the reason that I'm here is just to tell you that we're going to be able to put all of you on a Medicare Part D, whether you do it yourself or you come see us. Yes, ma'am.
You were talking about the Medicare for permanent.
The question was, there is a waiting time to get on in Medicare if you're deemed totally and permanently disabled. Isn't that waiting time still in effect, basically? And that answer is yes. What we'll do is that if are you talking about yourself? Okay. Well, what'll happen is that you will stay on the CIL, on the regular, the 307. When you are deemed totally and permanently disabled through Medicare, then you'll go on Medicare at these rates. So that's the other way. So you either have to be deemed totally and permanently disabled through Medicare, through Social Security to get on this, or turn 65.
Okay, so I'm going to kind of break it up into two parts: major medical, and then prescription drug.
Yeah,
That's really why we're here. So we're still going to be on United Healthcare.
No,
So we're leaving them entirely.
we are leaving them entirely.
Okay, that's good. 'Cause
Yeah.
the 35% rate
Yeah.
increase, I
There you
believe
go.
too.
Yeah, we're leaving them entirely. And let's just talk about prescription drugs for a minute. Okay, when President Bush, the second one, signed Medicare Part D into existence, here's what we did. There was a test, and if you were deemed actuarially equivalent to the most basic Part D plan, then you could actually keep your in-house prescription drug benefit. If you were not deemed actuarially equivalent, we had to put you on a Part D. So what we did, we had hundreds of people that we had to put on the Part D, and we did it. Okay, we actually wired our hall over there at 79th and Prospect for multiple computers, multiple printers, and what we did for a week straight, dark to dark, is that we had a Medicare Part D enrollment fair. Let's just talk about this in detail. Medicare Part D is going to cover just your prescription drugs. Again, everybody gets Medicare Part A for free. Part B is what you have to pay for. That's $185 for 2025. It's probably going to go up a little bit in 2026. Okay. Part D is just prescription drugs. Right now, and like I told you, I sign up a lot of people on Part D. I do a lot of shopping around during the open enrollment period, which is going to start October 15th. It's going to end on Pearl Harbor Day, December 7th. So let's say that right now we can sign you up on a Part D. Like I said, I can do it in 15 minutes or less. Okay. If you are prescribed, if you're not prescribed any drugs, you take no prescription drugs whatsoever, I can sign you up on a Part D that's going to cost you $0 per month right now. Okay. The average Part D is going to be somewhere between $24 and $28 a month per person. And that's going to be with roughly a $560 deductible. So per calendar year. So it's going to, you could be the person that gets a $0 prescription drug or a Part D. You could be the person who has to pay $92 because you take a lot of prescription drugs, and that plan's formulary is going to cover what you need. So that can vary, but just average, I've never signed anybody up on a Part D that cost them over $28. I know never's a big word, but I've been doing this a long time. So
Was SaveRx under the old plan, were they connected to United Healthcare, or were they separate?
they were separate, but what happened is that when you went to, let's say, CVS, okay, you presented your United Healthcare prescription drug card, okay. At the same time, you also presented CVS the SaveRx card called the SaveRx Wrap, okay. That was your deepest discount. But what we're going to be able to save you and what you're going to be able to put back in your pocket is going to more than make up for the difference in that.
So what is the, on a couple, two of us, a lot of couples here, what is the average? Or it's hard to say, do you still have them different tiers, tier A, you still
Yes.
have them?
Yeah.
But, okay, so what is the average it's gonna cost us per couple or per person with this new prescription plan? I know it's hard to say, but.
It really is hard to say,
Depends on your
but I mean,
medication.
in honest to God, I've got my laptop. I can whip the laptop out, and we can do this. We can have a live tutorial right here if you want to. But I'm saying average, and I'm kind of average high. It was probably $28 per month for both, for you and your wife, and then a $560 drug deductible per calendar year, with a cap of $2,000 in 2025 and $2,100 per person in 2026.
Okay, so.
The cap of 2,500?
No, that it's a cap of $2,000. So
Out of pocket.
out of pocket. So you're going to pay 20. And I'm just saying this. You're going to pay 28. Bill, you're going to pay 28. Okay. So per month for that Part D. Okay. In addition to that, you're going to pay a $560 deductible before they pay anything. You're going to pay a $560 deductible before they pay anything out of pocket.
Okay, so
With a cap of $2,000.
Okay, so now there's a lot of us here, and I'm speaking for us, but we're blessed to take very few drugs. Okay.
Yeah.
We're blessed. And under the old SaveRx plan, we didn't pay hardly anything for our drugs.
$10.
So this $500, we're gonna have to. I'm just gonna round it off to 500. Keep the math simple. Under this new plan, we're gonna be paying $500 out of pocket each, and then as soon as we hit that 5 something, then this plan kicks in up to a max of 2,000. Then after, if you got enough drugs that are over 2,000, then there's no cost after that.
Yeah. Then they
Somebody
cover.
here may be in that boat.
And I'm
not, and a lot of us may not be. So, we talked a little bit earlier, and I'm still optimistic about this so far, but it's going to cost us a little over $1,000 out of pocket, and we don't take that many drugs. So
okay. Sherry's saying no.
Everyone's situation is going to be a little bit different, right? We're on a Medicare journey. Would you be okay, Jason, if I kind of take over on the presentation with the Part D?
That's fine.
Real fast?
I'm going to be here for the whole entire time. If you want to ask me questions, have a discussion, let's go ahead and do it.
One, thank you so much for allowing Blue Cross Blue Shield to come in today and talk to you. My name's Sherry Blankenship. You may see my information on the flyer that you've received from the union regarding guidance on the Part D plan. Okay, so at some point outside of this meeting, you're also welcome to call or email me. But with the Part D prescription drug plan, I'm going to tell you they're sold by private insurance companies. There's more carriers out there on the market other than Blue Cross Blue Shield of Kansas City.
Correct.
Okay, but if we don't pick a plan, we're going to get a penalty. All right, so it's very important that we make our election. That can start as soon as October 15th. We want to make sure it's done by December 7th. Yes.
And is this penalty permanent?
His question is the penalty permanent? So yes, if you have more than a 63-day lapse in coverage on your prescription drug plan, they're going to assess a penalty. So what does the penalty look like? They're going to take the national average of a prescription drug policy, and it's $38 today. They're going to take that $38 and they're going to take 1% of that. That's about 38 cents, right? Doesn't seem like a lot of money. But what they're going to do is they're going to multiply that 38 cents by the amount of months you did not elect a prescription drug policy. So let's say you went 2 years. Maybe you were an individual that was like, you know what? I'm not going to buy a prescription drug plan. I don't take anything because I'm using a coupon service, right? When my prescriptions change in the future, I'll pick a plan during the annual enrollment period that's getting ready to start. Well, then the government's going to come in and go, okay, well, you were uninsured for 2 years. So now we're going to take that 38 cents. We're going to multiply it by 24. It's 1% times the amount of months you did not have a prescription drug policy. That will be your penalty every month for the rest of your life, unless you qualify for what's called Medicaid or CanCare, state assistance, or low income subsidy. I will tell you, a lot of individuals who may not qualify for Medicaid or state assistance may qualify for low income subsidy. So I'm going to encourage you to at least apply. If you can get low income subsidy, that's through the Social Security Department, also known as Extra Help on their search bar. If you qualify, you could have anywhere between 100%, 75, 50, or 25% of your premiums paid for and your prescription drug copays. So it's an extra assistance program. I always encourage everybody to apply. Worst case scenario, they tell you no. Question in the back.
Yeah, I'm sick, so I have how would that happen?
His question is, he has TRICARE. How would that affect him? So a lot of individuals in here may have military insurance, TRICARE, or VA, where you have with VA, you have prescription drug benefit through like VA facilities, right? I'm still going to encourage you to pick up a Part D prescription drug plan for the reason that if you have to go outside the VA to a different specialist and that specialist prescribes you a prescription, you want to be able to fill it. A lot of times what I hear with VA individuals is they don't want to go to some of the VA doctors, and a lot of times if you're going outside the VA doctors won't prescribe you a prescription if they're not seeing you for that service. So I'm still going to encourage it. If you're somebody who is VA or TRICARE, because TRICARE picks up your copays, right? That's kind of a nice benefit. But say you're one of those individuals and you don't pick up a Part D prescription drug plan, you shouldn't have a penalty because you have the government insurance policy, right? I mean, in the future. But I'm still going to say, hey, let's at least find something on the market that's the least expensive policy to have something in our back pocket. You can change it during annual enrollment if you want to. He wants to know how the VA plan is different than the standalone Part D prescription drug policies, okay? Typically with VA, those copays are a lot less than what you're going to see on the market with the standalone prescription drug plan. So I'm going to encourage you to use VA, okay? But if you want to go outside the VA, then you got to abide by the conditions of the standalone prescription drug carrier. Now, what I like to do is I go to Medicare's website. I plug in your prescription, your dosage, your quantity. Every insurance company has to file their formulary, which is a list of their prescriptions, with the government. They also have to file their negotiated rate with every single prescription, with every single pharmacy. So when we go in and we plug in your prescriptions, your dosage, your quantity, and your pharmacy, it will mathematically tell us which carrier is going to be the least expensive for you based upon your current prescription list. If you get a new prescription in the middle of the year, you just have to abide by whatever the contract says, whatever the copay structure is. You're probably going to have to write it out for the remaining part of the year. And then come the next year's annual enrollment, which is October 15th to December 7th, you have the opportunity to change to a different prescription drug carrier if you want to. I will also tell you on that website, some people are firm. I'm not going to a different brick and mortar pharmacy. I like my pharmacy. And I'm not saying pull away from your pharmacist, but I'm saying if you're somebody who wants to shop your prescription drug copays to find the least expensive cost, we can plug in multiple pharmacies. We can do up to 5 I always like to include mail order, right? And then I usually pick about 4 other pharmacies. You would be surprised. You can actually sometimes pick up a couple of prescriptions at this pharmacy for a lower cost and then go across the street and use a different pharmacy for your copay. Now, if you are somebody who wants to use GoodRx or Canada Prescriptions with an S plus.com, like a mail order, a different program outside of your Part D carrier, you have the right to do that, okay? But whatever you pay in copay with a coupon service or another organization, that will not go towards your calendar out-of-pocket maximum, okay? You're basically being a cash and carry. So just be kind of cautious with that. If you're someone who's pushing that 2,100 threshold for next year, it may not end up saving you as much money as you think, but it is your right to do so, okay? So a couple of rule changes this year. In 2025, the government said insurance companies, you can carry a deductible as high as $590. You do not have to have your deductible that high, but that you cannot give a deductible higher than $590. That is shifting to $615 in 2026. In 2025, the government said after a consumer's copays hit $2,000 on a worst case scenario, the insurance companies have to pick up at 100% for those in-network drugs on their formulary. It is shifting to $2,100 in 2026. Okay, so the coverage gap, like Jason was saying, or the donut hole, as it was referred to as a nickname, that has gone away. No one is impacted by that $8,050 threshold anymore, which is a nice thing, okay? So what can go into a prescription drug plan? You could have a premium. There are some plans on the market with a $0 premium. I've seen them over $100, okay? So sometimes individuals may be assessed, or per Medicare's website, it may look like a $100 premium plan is financially favorable for them, and that is probably correct because they may have a drug on that prescription list that is not covered under another company. So what we do is we like to do the math on that and see where we sit. All right, great question. Yep, her question is, what is the copay? The copays are going to change. They are not going to be the same for every insurance company. So it depends on your prescription drug list. That's why it's important to use the Medicare site to look to see what your copay would be for the prescriptions that you take. Now, I will tell you, just because an insurance company says there's a $615 deductible, that doesn't necessarily mean that all tiers are going to be subject to that deductible. There are some carriers out there that will allow you to have their copay structure for generics, and then usually the name brands or the preferreds could be subject to the deductible. There are also insurance companies that make that entire all 4 or 5 tiers subject to the deductible. So we mathematically let the system tell us where we're going to fall, okay? When it breaks it down, it will tell us if we're actually going to hit our deductible and if we hit catastrophic. It will also break it down by each prescription to let us know what the copay is going to be. Now, just because you have a deductible on your prescription drug plan, keep in mind, you still only pay the negotiated rate for the drug. So if a carrier comes in and the negotiated rate is $3, you're paying $3. If the negotiated rate is $200, you're going to pay the $200. But whatever your copay is, it goes towards the deductible, okay? The deductible also funnels into that maximum out-of-pocket, your worst case scenario, okay? But let's think about this a little bit. If your United Health Care plan was close to $300 a month, right?
Over
$300.
It's going over.
It's going, it would have gone over 300. And if your tie-in plan is under 100, that's already a $2,000 savings, right? What's our worst case scenario on the prescription? $2,100. So financially, I feel like you're still going to be in a good situation. All right? Question. So his question is he going to have to pay $500 for his prescriptions? Each. It depends. Everyone's prescription drug list is different. You may not hit $500. We may find you a carrier that doesn't have a deductible, right? I can't say that you're definitely going to hit it because there's a very good chance you may not. It sounds like you're mostly on generics. But if they come in and they prescribe you,
and it's like, that's why I just
Eliquis,
said 560.
Ozempic,
It's like, okay, that's average. Yeah, so.
Xarelto, the stuff you see on TV, right? Those are typically going to be tier 3 or tier 4 drugs. In my experience, those are going to be subject to the deductible. So when you walk in, you're going to have to meet your deductible. After you meet your deductible, then you go to copay, stopping at $2,100. His question is, how do the tiers rank? Tier 1 is going to be your preferred generic. Tier 2 is going to be just a regular generic. Tier 3 is going to be a preferred brand. Tier 4 is going to be a non-preferred brand. We're getting more expensive, right? Tier 5 is going to be your specialty drugs.
So one's the cheapest, five's the highest on the cost of the drugs.
Yes.
For the individual.
He says the higher you go in tier, typically the higher in cost of drugs. Yes, correct. Question. His question is regarding durable medical equipment.
Yeah.
Durable medical equipment is going to fall underneath Medicare Part B. So that means when you go and you fill any durable medical equipment, you're going to show your Medicare card, and then you're going to show your new Blue Cross Blue Shield card. If Medicare allows for the service, your supplement or your Blue Cross Blue Shield plan is going to allow for the service. Next question. Question is regarding durable medical equipment. May I ask you, are you on United Healthcare's plan, or are you already on the Blue Cross? Okay. So if you're on United Healthcare, then it's going to bill under Blue Cross. But I believe you said Blue Cross Blue Shield's already paying your bill. Okay. You may not be on United Healthcare, so that's just going to continue to roll forward like it did last year, right? No changes. Really, the change is going to come in place for the ones who are on the United Healthcare plan. We got to make sure we pick a Part D carrier. Question. His question is, who is the administrator for Blue Cross Blue Shield? As far as
That's our third party administrator is Wilson McShane. Yeah.
she wanted to know who the third party administrator is, and that's Wilson McShane. Any other questions before I go to the next slide? His question is, he hits catastrophic, and he hits catastrophic on the first month due to the cost of his drug. That's going to be the same. If you're on a really expensive prescription, odds are you're going to hit catastrophic in January like you're used to. And then after your catastrophic is satisfied, your copays go to 0. Yes. Great question. Her question is, you have Dexcom, like the continuous glucose meter? Okay. So Medicare, traditional Medicare, covers continuous glucose meters when they're deemed medically necessary. So therefore, you're going to show your Medicare card, and then you're going to show your Blue Cross Blue Shield card. Yes. Great question. His question is, will you automatically have to enroll every year on a Part D carrier once this is set up? Okay. Let's just assume the union's not doing any other changes, right? Okay. Okay. All right. So if we pick a Part D plan and that Part D plan decides they want to leave the market, then you've got to reshop your plan. They're going to send you a notification. All right. I'm going to tell you to look at your prescription drug plan every year anyway, around October 1st. Even if your plan stays on the market, they could change their copay structure a little bit, right? So every year, just kind of take a look at it. If your copay looks like it's something that is not desirable for you, then reshop it. You can do that between October 15th and December 7th. But if you like your plan and they're staying in the market, you don't have to reapply every year. They'll just roll you over. Just make sure you pay your premiums. As far as premiums go, while we're talking about that, you can have your premium come out of your Social Security check, or you can get a bill in the mail. But I'm going to tell you, if you get a bill in the mail and you don't pay that premium, they will cancel your plan. And unless you have a qualifying event, you're not going to be able to pick one up mid-year. And then come next annual enrollment, you're going to be hit with a penalty. Okay? So pay attention to those bills. All right.
Sure.
If you're worried about that, you're somebody who does a lot of traveling, you're worried about what happens if you're in the hospital, you don't have anybody checking your mail. If something like that happens,
don't do that.
have it come out of your Social
I
Security
mean,
check.
I've dealt with multiple people.
All right. His
No.
question is they're holding money out of my pension by changing from United Healthcare to the new plan. Does that mean it's going to change my pension?
Yeah, your pension is going to actually go up because we're not going to be taking out as much as United Healthcare cost.
I'm gonna get an increase in my pension
Yes.
instead of, I didn't want to, they're holding out
But
700.
then you have to turn around and pay Social Security.
Well, I mean,
New drug plan.
well, let's just say one thing right now, and we were talking about this. Somebody had a VA and a TRICARE question. Okay, what I would do if you're using, and I'll answer this and I'll answer yours. Sign up if you're using VA for your prescription medication, and you're probably not going to use Medicare Part D. I would sign up on that for that Part D that costs $0 per month, because I'm telling you, if you don't sign up when you're first eligible, you're going to pay that penalty. Got a really good friend that said, no, I told him, I said, Mike, you need to sign up right now. You're eligible for Medicare Part D. Let's get you signed up, even if it's like $2-3. Back in the day, some of them were $2-3. A lot of them were like $10 a month. He said, no, I'm using VA. But when the VA wouldn't cover a medication that he was prescribed, he wanted to get on Medicare Part D, and he paid a penalty, so he didn't do it. So I would just go ahead and sign up on that $0 per month Part D, so you're covered. Now, your question, that's the reason that we're doing this. This is going to put money back on your pensions, okay? Literally, the difference per couple is going to be $646 per month.
Right now we're paying 703.
Okay, yeah. So I mean, you're actually above the average just on what it's going up right now. It in 1/1/26, that's going to be $1,260 per couple per month. The difference of what CIL is going to charge you and what UHC would charge you on January 1st is $646 per month. That goes back on your pension check.
So what would they be holding out? They won't hold nothing out of my pension.
No, yeah. I mean, well, we're going to be withholding $614 per couple right now. I mean, you're
He will get $600 back on his pension.
Yes. Yes.
Okay.
Yep.
When you do that.
Yeah.
I understood that they say you had to make payments for what the D part.
Yeah.
To Social Security.
And that's another issue in itself. What Sherry was talking is exactly right. I've had people that just took, their Medicare Part D, had it deducted out of their Social Security, $10, $15, $28, whatever it's going to be, whatever Part D you're going to need. Or I've had people that actually had a paper bill sent to the house. Well, I've got a gal. She's a survivor of one of my members. She forgot to pay her bill. She went with a lapse in coverage, and then when she re-enrolled, they wanted to assess her a penalty. So I'm telling you right now, don't put yourself in that situation. Just have this taken out of your Social Security. It comes out every month. You don't have to worry about it.
I'm pretty sure that if you have it done, they will take 3 months at a time, because I had to pay the prepaid Medicare, because I wanted to wait on Social Security drawing until I turned 67. So I had to pay Social Security $200 a month, but they billed me 3 months at a time.
Yeah. Usually it's just a month.
As simple as, well, they're just gonna take $20 a month, because they're probably gonna want you to pay $300 for 3 payments if you have a bill sent to you, because that's what they did.
Yeah.
That is for Part B. That's for people who are getting their Medicare in place and don't want to take a Social Security distribution. They will bill you quarterly, but you can call Social Security and ask them to bill you monthly. But on the Part D prescription drug plan, when you call Medicare to do your enrollment, right? Once you figure out what plan you want and you call Medicare to do your enrollment, if you tell them to take that out of your Social Security, sometimes it can take up to 3 months for that withdrawal to happen. And if they don't do it right away, they're going to catch you up when they do draft it. But after they get that first draft in, it's going to be month to month. Okay, it will be month to month. But I will tell you this: if you tell Medicare to sign you up to have your premiums taken out of your Social Security check, but your carrier, say you chose Humana, right? Maybe you chose the Humana plan, it was $16.80. I don't know, right? I'm just throwing one out there. Yeah. If you get a bill from them, you better pay it, because there may be a disconnect between Social Security and Humana until you figure it out, or whatever insurance company you have. All right. Most of the time it's pretty simple. It's really smooth, usually runs like clockwork. But if you ever get the bill, you pay it, and then your next call is to that carrier and you say, hey, this was supposed to come out of my Social Security check, so they can notify whoever they need to notify to get it corrected. But it will be, once it's established, it'll just be once a month, I promise. Any other questions before we dive into the next piece? Yes. His question is, will everything switch over automatically with the exception of the prescription plan? And that is correct. They're going to crosswalk you over into the new policy. His question is, how do we use that online service? Okay. And this is what it looks like. You're going to go to Medicare.gov, which I did a step-by-step in each one of your guys' flyers, so you should have it. Now, you can call me. I'm more than happy to help guide you along the way. I will tell you, this is a very busy time of the year. There's quite a few individuals that are impacted by it, okay? If you can't reach me, I'm sure you can. Jason is here for guidance as well. I will tell you, I'm getting about 30 to 40 voicemails a day, okay? So sometimes my individuals I assist like to email me over their prescription list, their pharmacy and their zip code, and then I work it and I send it over to them and say, this is who I'm showing
this is perfect,
is ideal.
because
all right, so what does that look like if you want to handle it on your own? Because I know there's a lot of internet savvy people here, and you probably want to play around with the system a little bit, and knowledge is power, right? So if we do it this year, we might be able to play around with it next year. You might even be able to help family members or brothers or sisters. But you're going to go to Medicare.gov. Once you're on there, you're going to, underneath the gentleman with his hands crossed, you're going to see a box. I highlighted it in yellow for you. You're going to click on Find Plans Now. Once you do that, it's going to take you to another section. You're going to put in your zip code and your county. Now, I just threw in one to show you guys that there's multiple counties to choose from, right? Because not every insurance company is in every county. So we got to make sure we put in the right demographics. Right now, you're going to see coverage for 2026 and 2025. You make sure you mark 2026 so you're getting the right company, okay? Because UHC is going to carry you all the way till the end of 2025. We want this to go live 2026. Once you do that, you're going to click the green Continue button. Then I'm going to have you click the middle button. It's going to say Medicare Drug Plan Part D. You're going to hit Find Plans. I'm going to caution you at this time, if you call Medicare to do your enrollment, or if you choose Medicare Advantage, you have the right to do that if you want, right? You have the right to do that. But if you leave the union plan, you do not get to come back, okay? So just be very careful. You want a Part D prescription plan only. You do not want somebody to walk you into a Medicare Advantage, okay? So once you hit Part D, you're going to hit Find Plans. Now, if you're somebody that gets state assistance, you can mark that you get state assistance or low-income subsidy. It'll show you the discounted rate of the drugs. I'm assuming the majority of you in here will just say you're not getting assistance. So we're going to mark, I do not get help from any of these other programs. You're going to hit Continue. Do you want to see drug costs? Yep, that's why we're on here. We definitely want to see our drug costs. When you're on here, this is where you're going to put in the name of your prescription. Okay, you put in the prescription, you hit Add Drug. You're going to change your dosage. Okay, could automatically populate one for you, but make sure you check your dosage. Then you're going to put in your quantity and how many times you fill that. Okay, so I'm going to break it down just a little bit. If you're doing a 90-day fill and you're taking that pill once a day, you're going to put in 90 and you're going to drop it to 3 months. If you're taking that pill twice a day, it's going to be 180 for 3 months. If you do monthly, okay, that's how it works. If you get to the end, if you put in your pill count and you get to the end and something doesn't look right and you're like, that lady at Blue Cross Blue Shield told me my prescriptions are capping at 2,100, but your numbers are a little off, odds are you put your quantity count in wrong, okay? You got to make sure your quantity count matches, so then that way the pharmacy manager, mathematically adds it up correctly for you. So you're going to hit add to my drug list. Now, let me go back. Once you hit add to my drug list, it's going to take you back over here again, and you can say done, or you can put in another drug, okay? We want to list all our drugs. Then you're going to choose your pharmacy. Make sure you have in your zip code. You're going to choose your pharmacy, do multiple ones, okay, if you want to. Then you're going to hit continue. Now next, what you're going to see, I kind of split it out for you a little bit. But see up there where it's highlighted and it says back to plan, that's if you need to go back and add another prescription, because we know we all forget the eye drops that are sitting on our nightstand or the creams, right? So if you got to go back and add it, that's where you do it. But you're going to sort by lowest and premium drug cost. It should automatically be defaulted to that. Medicare always usually defaults it to that, but obviously we're not in control of that website, so just make sure it says that. Then it'll come down and it'll tell you which carrier is ideal for you based upon your drug list. You're going to be able to see all the insurance companies. So if there's a company out there that you're like, I'm not doing business with them, just skip them. Go on to the next one. Who's second in line after that? Okay. I will tell you in Kansas, there is a $0 premium plan. It's administered by Kansas Blue Cross Blue Shield. Okay. In Missouri, there used to be a $0 plan in 2025 called WellCare Value Script. It has increased to $9.60. I have not found a $0 plan in Missouri yet. All right, but there still is one in Kansas. Now, once you're in here and you pick your plan, you can hit the blue button that says Plan Details, which gives you a breakdown in every single one of those copays, okay, underneath that plan. And it'll tell you if there's a deductible. It will also break down the cost of each prescription so you can know what the negotiated rate is. And then say you like that plan, you just hit the green enroll button. That's it. You put in your Medicare number, your name, your address, your date of birth, and how you want it billed. And then you get an ID card in the mail in about, right before January 1st, but you'll get a confirmation letter within 10 days. Yes, you had a question, sir.
Where's the part where you decide how you want to bill?
Once you hit enroll now,
It'll flip up.
it'll flip up. Yep, it is so easy, really. When Jason said he can get it done in 15 minutes, it's very fast as long as you have all your prescriptions in front of you. If you need help, I'm here to help you, okay? Question. His question is, if he puts in his prescription list and then mid-year he gets a new prescription, what happens? You just fill it at the pharmacy like you normally do. You don't have to go into Medicare's website. This is just a tool to help you find it. I will tell you this, though, if you're like, oh, that copay just doesn't seem right, go on to Medicare's website, plug in the name of that prescription, and click your plan. It'll actually tell you what the negotiated rate is. Yep, great question. His question is, individuals who are not as computer savvy, you are more than welcome to call myself. Okay, I'm here to help guide you. You can also call Medicare. They're going to do the exact same thing over the telephone as well. I will tell you, Medicare is 24/7. Okay, so if you don't want to hold for an hour, call it in the evening time. Okay, but you're also welcome to call me. Ideally, if you can email me your prescription list, you'll probably get a faster response from me just because it's kind of busy time of year right now. I know some people don't. They retire and they just give it up. And they're like, I'm in my golden years. I'm not messing with that. His question is, if you need a new drug in the middle of the plan, how do you add it? So you don't have to add it in the system. This is just a guide to help you get started for the year. You just go to the pharmacy and hand them your card like you normally do.
They'll adjust it automatically?
Yep, insurance companies are keeping track of all that. And we know exactly where you sit.
Okay, so it's real easy transition if it does happen.
It's a very easy transition. Yes, great question. His question is, if I get a new prescription and it's really expensive and I want to shop my pharmacies, how can I do that? Very easy. Just go to medicare.gov, put in the name of the prescription, and then you choose your plan because it's already been chosen, right? So once you choose your plan, then if you hit plan details, you put in multiple pharmacies, right? You hit plan details, it'll tell you who's the least expensive. Yep, absolutely. Great question. I use that tool all the time. Yes. His question is, can you do this on your phone? You can. It's harder. It really is. It's harder. You know, you go to the library, I can run it for you and email it over to you and say, this is who I'm showing. Call Medicare with this ID number, you know, whatever you want to do. There was a gentleman behind. His question is going to resort back to the medical piece, not the prescription piece. So he wants to know if this is the plan that they're crosswalking you into, if it's a PPO or an HMO. It's really neither, right? It's any doctor or hospital that allows for Medicare, because Medicare is going to be your primary, right? So it's not really a PPO or an HMO. Great question. His question is, if you are already somebody who is on the regular plan with Blue Cross Blue Shield and you already have a Part D plan in place, do you have to do anything? You do not have to do anything unless you want to change your plan, and this gives you the window to do that. Yep, great question. Yep, this is really only impacting the ones who are on the United Healthcare plan. No. You don't. You cannot have a Medicare Advantage plan and a standalone Part D prescription drug plan. One company would have kicked out the other. So yes, you have a prescription plan, but that Part D is built into the United Healthcare. So when the United Healthcare goes away, so does the Part D. You've got to enroll. Great question. I'm glad you brought it back up, so then that way we could clarify for those that aren't here today. Question. His question is regarding the medical. What if there is a deductible or a copay attached to the new policy? And no, there is not. It is going to cover. There's no deductible. The plan that Blue Cross Blue Shield is providing does not have a deductible. Medicare is going to be your primary processor, and then we are going to come in as secondary.
So there's no $250 deductible?
There's no $250 deductible. Nope. Hold on to that money and use it towards your prescription copay. That right. Yeah, that's correct. Yes. That is a huge plus. Plus your premiums are going down, which is even better. Yes, question. If you leave the union plan, you do not get to come back. Okay? If you decide you want to go with a different plan, which is your right to do, if you don't like that plan in the future, they change the benefits and you say, oh, I shouldn't have left the union, you try and come back, you don't get to come back. His question is, I will tell you this, Blue Cross Blue Shield of Kansas City doesn't have a prescription drug plan. We don't offer one. The only thing we're doing here to offer you is the ability to help you navigate the system to find which carrier would be ideal based upon your drug list. Then you're going to get that name and you're going to call Medicare and do your own enrollment.